Welcome to OSMS. Congratulations on your decision to schedule your joint replacement surgery. Whether your surgical experience is in a hospital or in one of our OSMS surgery centers, this video will highlight key teaching topics which will be useful to you throughout your joint journey. As you prepare for your upcoming joint replacement surgery, we want you to know that we are here for you every step of the way. And together, we will get you back to the life that you love. Once your surgery is scheduled with one of our OSMS surgeons, you'll meet with a member of the prep team. During your initial meeting with the prep team, they will discuss your pre-surgical timeline, as well as make some of the necessary appointments that you will need. Several of your important dates, including appointments before and after surgery, will be outlined on the first page of your joint journey booklet. Our OSMS prep team is your primary point of contact for all things surgery, from the time you are scheduled for surgery through your recovery period. The prep team has got you covered. If at any point throughout your surgical experience you have questions or concerns, contact OSMS at 920-430-8113 and ask to speak to a member of the prep team. Here at OSMS, we believe that promoting a healthy lifestyle before and after surgery is critical to your recovery outcomes. Balanced nutrition and regular physical activity are important components to your overall health. In the months and weeks leading up to your surgery, we encourage you to take a closer look at your health and recommend that you incorporate healthy lifestyle choices. These same healthy lifestyle choices will be equally important before and after your surgery. Tobacco can negatively impact your recovery. Tobacco products can significantly slow wound healing and negatively affect bone growth and regeneration. Tobacco use can also increase your risk of developing a blood clot. Leading up to your joint replacement surgery, please consider stopping all tobacco products. If you need assistance during this time, the prep team can provide resources and support. Lastly, we want you to know that OSMS surgery centers and hospitals are smoke-free facilities. There is no smoking or use of any tobacco products allowed in the building or on the grounds. In preparation for your joint replacement surgery, there are several things we would like you to consider. Find a coach, a person who can help care for you throughout your joint journey. You'll need support the day of surgery, as well as during the weeks to follow. It's important that you have someone stay with you during the first week of your recovery. Pre-surgical clearance. You may be required to see your primary care provider prior to surgery. You may also need appointments, such as diagnostic lab work. The prep team will help you coordinate these appointments. Clear your recovery schedule. Plan ahead and try to reschedule any non-critical appointments during your recovery phase. This would include routine dental appointments. You should plan to wait 3 months after your joint replacement to see your dentist. If a dental emergency should occur, please let the OSMS prep team know. Obtain all medical devices or equipment that you may need. This may include a walker, cane, shower chair, grab bar, raised toilet seat, or reacher. If you need to purchase these items, please refer to the Patient Resources tab in the back of the Joint Journey book. Before your surgery, it's important to take some time to prepare your home. We want you to feel safe and comfortable going home following your surgery. Make sure your home is clean and your laundry is done. Clear the floor, including area rugs and small items which can increase the risk for falls. Organize cords and declutter areas. Make sure you have a comfortable and supportive chair and are able to elevate your surgical site. Make sure your chair isn't too deep or too low that you struggle to get in or get out of the chair. Consider your daily routine and make sure your frequently used items are easily accessible. You may need to rearrange furniture to allow space when walking with a walker. Pay close attention to the bathroom and the process you'll take when showering. Consider installing a grab bar or shower chair for your safety. Ensure that healthy, nutritious meals are available to you following surgery. Consider meal planning or preparing meals in advance for your recovery phase. Consider purchasing stool softeners if you do not have them at home. Over-the-counter medications such as Colace, milk of magnesia, Miralax, or Metamucil would be helpful in preventing constipation after surgery. Practice using the stairs and getting in and out of the car safely. A physical therapist will review these things with you, and there are additional resources within your Joint Journey booklet. If you have pets, please make arrangements for them to be cared for during and following your surgery. When you're packing your bag for surgery, there are a couple of things we want you to remember. Be sure to bring your photo ID and insurance card. Remember, comfortable, loose-fitting clothes and a good pair of walking shoes. Bring all of your necessary toiletries, including your toothbrush, toothpaste, deodorant, and any other hygiene products you desire. Bring your cell phone and your cell phone charger. If you use a CPAP machine, please bring the machine. Distilled water will be provided. Don't forget your walker. As far as jewelry or other valuables, do not bring any the day of your surgery. All meals and snacks will be provided for you. However, if you have any specific nutritional needs or wants, please plan accordingly. Regarding your home medications, if you're having surgery at a hospital, do not bring your home medications. However, if you're having surgery at an OSMS surgery center, please bring all your home medications in their original prescription containers, including inhalers and any new prescriptions your surgeon may have prescribed. 1 week before surgery, you should stop taking all vitamins and herbal supplements. Additionally, 1 week before surgery, you should stop taking all anti-inflammatory medications, such as aspirin, Motrin, ibuprofen, Aleve, naproxen, meloxicam, diclofenac, and Celebrex, unless otherwise instructed. These types of medications can increase your risk of bleeding. If you currently take any blood thinners, any anti-diabetic medications, or use a medication pump or patch of any kind, you will be given detailed pre-operative instructions by a member of the prep team or a hospital representative. Following your surgery, you should anticipate new prescription medications. Your surgeon may prescribe these for you in advance, and you may be instructed to pick up the medications prior to surgery. Following a joint replacement surgery, your surgeon will prescribe an antiplatelet or anticoagulant, such as aspirin or Xarelto. These medications will help to prevent blood clots from forming after surgery. You should also anticipate being prescribed a non-steroidal anti-inflammatory medication, such as Celebrex. This type of medication will help with post-operative inflammation or swelling. Additionally, you may be prescribed a narcotic pain medication, such as hydrocodone or oxycodone. These narcotic medications will help to manage your post-operative pain. However, can cause side effects such as constipation, nausea, dizziness, or confusion. Your detailed post-operative medication instructions will be reviewed with you and your coach before you are discharged home. Be sure to note what to stop, what to start, and what to continue. It's important to self-monitor before surgery. Your surgical outcomes are contingent on your pre-surgical health. If during the 2 weeks before your surgery date, you experience an infection, fever, chest congestion, or if you noticed anything on your surgical extremity such as a cut, scrape, bug bite, or rash, please notify the OSMS prep team as soon as possible. In order to help prevent post-operative infection, you'll be asked to shower twice with antibacterial soap called HibaCleanse. HibaCleanse will decrease the amount of bacteria on your skin. You'll shower once the night before surgery and again the morning of surgery. When you shower with the HibaCleanse soap, do not use it on your hair, face, or genital area. Wash your hair with your own shampoo and rinse. Wash your face and genital area with your own soap and rinse. Then, wash the rest of your body with the HibaCleanse soap. Using a quarter of the bottle, lather the soap and scrub your body. Let the HibaCleanse sit for 60 seconds before rinsing. Repeat this again using another quarter of the bottle. Dry your hair and body with a clean towel. The night before surgery, be sure to sleep in freshly washed sheets and pajamas. The morning of surgery, you'll shower again, repeating these steps exactly. After your shower, please do not apply any deodorant, lotion, powder, makeup, chapstick or lip balm, nail polish, perfume or jewelry. Dress in clean, freshly washed, and loose-fitting clothing. Brush your teeth, but do not swallow any water. If you're having surgery on your lower extremity, please do not shave your legs within 2 days of surgery. Any cuts or scrapes from shaving could result in your surgery being rescheduled. The day before your surgery, eat a normal diet. Try to avoid anything that might be irritating to your stomach, and be sure to drink plenty of water. You will be given detailed instructions regarding when to stop eating and drinking prior to surgery. Stop all solid foods 8 hours prior to surgery arrival time. This includes gum, mints, and hard candy. Stop all clear liquids, including water, 4 hours prior to your surgery arrival time. This includes soda, Jell-O, popsicles, broth, black coffee, or plain tea. In the days and weeks following your surgery, it's important to eat a well-balanced and nutritious diet. Your body needs high-quality calories and lean proteins to promote healing. Before and after surgery, physical therapy will be available to you. Prior to surgery, you'll have the opportunity to meet with a physical therapist. During this preoperative appointment, the therapist will instruct you on stretches and exercises that will be beneficial for you before and after surgery. They will also review assistive devices, how to use the stairs, and how to get in and out of a vehicle safely after surgery. Following a hip or knee replacement, you will use a walker. A two-wheeled walker is preferred. A therapist will show you how to adjust your walker for your appropriate height and teach you how to safely use it. It's beneficial if you practice this at home before surgery. The day of your surgery, the team of physical therapists and nurses will be there to help get you moving. You'll be walking with assistance shortly after surgery. The physical therapist will assess your strength and your range of motion and guide you through a few post-operative exercises. Based on your surgeon's recommendations, you may be prescribed outpatient physical therapy. Therapy appointments are typically 2 to 3 times a week for 4 to 6 weeks post-operative. In the days before surgery, you'll receive a call from the surgery team. They'll tell you what time your surgery is scheduled for and what time you should arrive. If you are instructed to take medications the morning of surgery, you may do so with a small sip of water. Remember, you cannot have any food or any other fluids at this time. If you're having surgery at an OSMS surgery center, please arrive 1.5 hours before the start of your surgery. If you're having surgery at a hospital, please arrive 2 hours before the start of your surgery. This time is needed for the team to get you prepared for surgery and for you to meet with your surgeon and the anesthesiologist. The anesthesiologist will discuss your anesthesia options. Both general and spinal anesthesia will be discussed. Please speak with your surgeon about your anesthesia plan prior to surgery. If you have additional questions regarding what type of anesthetic would be best for you, please refer to the Joint Journey booklet or contact a member of the prep team. Once it's time for surgery, you'll be in the expert hands of the highly skilled operating room care team. You, your safety, and your best surgical outcome will be the top priority. Immediately following your surgery, you'll be brought to the recovery area, where you'll be closely monitored by a nurse. You may feel drowsy during this time. You'll have a surgical dressing on your incision, and you may have compression stockings on your lower legs to help with circulation. There will be an ice cooler to provide cold therapy and to help decrease pain and swelling. If medications are needed, you'll receive them through your IV. Once you're awake and ready, you'll be moved to your room. If you're spending the night, all overnight rooms are equipped with private bathrooms. The rooms are spacious and comfortable to accommodate you and your visitor during your surgical experience. Our priority is to keep you safe and comfortable during your stay. Once you're in your overnight room, your nurse will instruct you on how to use an incentive spirometer, or IS. The IS is a breathing device and will help your lungs to fully expand and prevent post-operative complications, such as blood clots and pneumonia. It's important to remember that this device measures your inhalation, not your exhalation. Slow, deep breaths are the key. You'll also receive IV antibiotics as prescribed by your surgeon. These antibiotics are important to help prevent infection. You'll be offered food and drink gradually at this time to prevent nausea and other complications. Your bladder will be monitored to ensure that it's functioning properly after surgery. Physical activity will be slowly introduced, and together with your nurse, you'll sit at the edge of the bed and walk to the bathroom and eventually throughout the halls. In the hours following your surgery, the care teams will work closely with you. They'll be monitoring you regularly, checking your vital signs, assessing your pain, and inspecting your surgical dressing. This recovery period is an important time, and our care team will help guide you through it, ensuring your safety. Following your surgery, our team will work closely with you to achieve tolerable levels of pain. Cold therapy, elevation, and pain medications, both narcotic and non-narcotic, may be used in combination. Together, we'll find a pain management strategy that works for you. It's important to know that narcotic pain medications do have side effects. Constipation, nausea, dizziness, confusion, and urinary retention are all examples. While taking these types of medications, please do not drink alcohol, drive, operate machinery, or make any important decisions. It's also important to know that narcotic pain medications can be addictive in nature. The ideal post-operative pain management plan would be to use the prescription narcotics only when needed, and when possible, consider transitioning from narcotic to non-narcotic medications. Our OSMS surgery centers provide an outpatient joint replacement experience. This means that your surgical stay is less than 24 hours. If you're having surgery at a hospital, both outpatient and inpatient joint replacement experiences are available. If your surgeon anticipates that your surgical length of stay will be greater than 24 hours, you may be scheduled as an inpatient procedure. Some patients, depending on their pre-surgical health, their past medical history, and their home environment, are eligible for a same-day discharge. This means that the patient is able to be discharged home without an overnight stay. In these situations, planning for a same-day discharge is done ahead of time with your surgeon and your coach. Together, you and your surgeon will determine the best plan for your surgical experience. Once you are home, your safety will remain a top priority. It's recommended that you do not drive until after you've received clearance from your surgeon. In order to operate a vehicle safely, you should not be taking narcotic pain medications and should have adequate muscle strength and mobility. In order to help prevent infection, keep your incision clean and dry. Do not soak your incision in water. Wash your hands frequently and try to avoid touching your incision or dressing as much as possible. Do not apply any creams, lotions, or ointments to your incision site. Additionally, please monitor your dressing for drainage. If your dressing ever becomes greater than 50% saturated, please contact the OSMS prep team immediately. You may be instructed to change your dressing. In the weeks following surgery, it's important to monitor for signs and symptoms of infection. If your incision becomes red or hot, if you experience cloudy drainage from your incision, if you experience a fever of greater than 101 degrees for more than 24 hours, if you experience an increase in pain or swelling not relieved by your pain medication, contact the OSMS prep team immediately. In order to help prevent blood clots, frequent short walks and gentle exercises are encouraged. Additionally, follow your post-operative anticoagulant medication instructions and continue to wear your compression stockings and use your incentive spirometer as prescribed. Although rare, blood clots can occur after surgery. In the weeks following your surgery, it's important to monitor for signs and symptoms. If you develop a reddened, tender, warm, or swollen calf, contact the OSMS prep team immediately. If you experience shortness of breath or difficulty breathing, call 911. As you go through your joint journey, remember that you are not alone. If at any time you have questions, please contact OSMS at 920-430-8113 and ask to speak with a member of the prep team. We are here for you every step of the way, and we are dedicated to getting you back to the life you love.